We looked at information on around 12,000 young people aged 14 years from a large study called the Millennium Cohort Study. And we looked at their answers to questions around feelings of depression. And we looked at that in relation to the amount of time that they spent on social media platforms. And we found a really clear, strong, graded relationship with the more time girls in particular were spending on social media platforms, correlated very strongly with depressive symptoms. We also saw an association or a relationship for boys, but it was less strong than it was for girls.
So the obvious question is, why are girls suffering more than boys? And is it only due to the length of time they're spending on social media, or are there other factors at work?
To my mind, it's about the content and the context of use. So I'll say what I mean by that. Content in terms of what young people are encountering is key. And girls were more likely to, for example, report feelings or experiences rather of being harassed or bullied online compared with boys. They were also more likely to be reporting problems around body image and their self-esteem. There are also impacts in terms of the context of use. So both girls and boys were more likely to be reporting poor sleep if they were using social media for extended hours.
And this study was published pre-pandemic. I can only imagine that it's got worse because teenagers will be spending more time online, perhaps, or be using more screen time?
Well, interestingly, it could go either way. During the pandemic, teenagers and in fact all of us, not just teenagers, were spending, a lot more time on social media platforms and connecting with each other via digital technology. So really, this could be a lifesaver, quite literally. For teenagers and for adults and older generations as well. So it's too early to tell whether there are links between social media, firstly, whether they are causal in relation to young people's mental health, because it could go the other way around. It could be that young people who are particularly vulnerable and have pre-existing poor mental health are more likely to go online and engage on social media websites. So that's one thing to think of. But also because of the huge benefits of using social media platforms, for young people as well as for adults and older people, we really don't know whether the amount of time that that extended amount of time during the pandemic period has had negative impacts in and of itself on people's mental health.
I'm sure you're hoping this study will help inform us all on and about social media and perhaps change policy, in which case, what changes would you like to see and who should be leading these changes? Governments, policymakers, parents, teachers?
There are many, many, many different policy settings that we could. So young people need to be able to navigate these online environments skillfully and know how to deal with negative content and negative experiences online. That's really, really key. There's a raft of things that people could do in terms of improving sleep, perhaps not having mobile devices in bedrooms, those sorts of things, so that one can have unbroken sleep and the temptation to check the mobile device is then removed if you don't have the phone in the bedroom.
One of the big problems with bullying and trolls online is anonymity. If there's less anonymity, perhaps there'd be less trolling.
We have to really work with social media organizations in order to have, a better degree of surveillance and monitoring around trolling and obnoxious behaviors online. Absolutely. It's all part and parcel of it. The government need to be involved in that for sure. But government also need to sort of pay attention to other structural things that are going on, harmful online content, which, that sort of often these commercially run social media platforms, young people can be bombarded by a variety of commercial content above and beyond their individual interactions that they're experiencing online. So I think an all-round look at that online environment, how it can be better regulated, is really key to this.
Professor Kelly, many thanks to you for joining us on The Agenda.
It's a pleasure.